Thank you, Gina. What role do eicosanoids play in inflammation? Important diseases that are mediated by the production of eicosanoids include heart attack, asthma, arthritis, ulcerative colitis, dysmenorrhea, and persistent headaches. The eicosanoids of concern are divided into three groupings: prostaglandins, thromboxanes, and leukotrienes. Prostaglandins. Prostaglandins primarily affect platelet aggregation as well as blood vessel constriction and relaxation. Some prostaglandins have a favorable effect on the integrity of the gastric lining, regulation of kidney function, and initiating some stages of childbirth. Some negative effects are that they intensify pain, cramping, and blood circulation restriction with regards to PGE2 being the main prostaglandin involved in inflammation. Thromboxanes. Thromboxanes are produced by platelets and enhance aggregation as well as constrict blood vessels and bronchioles. Thromboxanes have a negative impact on cardiovascular health and asthma. However, they play a huge role in response to injury as they limit blood loss. Leukotrienes. Leukotrienes come from immune system cells and stimulate the production of immune signaling molecules like interleukins, interferon, and other substances involved in anaphylactic reactions. Leukotrienes are associated with their contribution to allergies and autoimmune diseases. Eicosanoids, as Gina said, come from arachidonic acid released by the action of the enzyme phospholipase A2. Phospholipase A2 is commonly a participant in cell membrane maintenance. However, it is induced in more prevalent amounts by triggers involved with the initiation or maintenance of inflammation. What therapies, drugs that are used to treat inflammation caused by eicosanoids? Most drugs used in the treatment of diseases that involve inflammation block the production of eicosanoids after the arachidonic acid has already been produced. These drugs are used to inhibit the cyclooxygenase enzymes. This is the main role of many common over-the-counter non-steroidal anti-inflammatory drugs, or NSAIDs. Common over-the-counter non-steroidal anti-inflammatory drugs include aspirin, such as Bayer, acetaminophen or Tylenol, ibuprofen or Motrin, and naproxen or Aleve. There are three cyclooxygenase enzymes: COX-1, COX-2, and COX-3 that is still under investigation. and won't be a topic in this presentation. The first of the two cyclooxygenase enzymes to note is COX-1. While inhibiting COX-1 can reduce inflammation, it can produce undesired side effects like gastric damage, liver damage, and renal toxicity. COX-1 is virtually everywhere in the body and is very important in homeostasis. The second cyclooxygenase enzyme is COX-2. Primarily inhibiting COX-2 reduces inflammation. COX-2 is more limited in the body than is COX-1. However, it does appear in large quantities in response to inflammation triggers. By the inhibition of COX-2 for prolonged periods can also have undesirable results, such as diverting arachidonic acid metabolism to the production of leukotrienes. There are 3 lipoxygenase enzymes that block leukotriene synthesis. 5-LOX, which is of main interest, and 12-LOX and 15-LOX, all of which Gina brought up in the first part of the presentation. The primary lipoxygenase enzyme of interest is, as I mentioned, 5-LOX. The main interest is placed on 5-LOX as research appears to show that it is the key enzyme for blocking leukotriene synthesis. An example would be asthma, and the constriction of bronchioles is the trigger of an attack, and LOX inhibitors are the method of therapy. Why is this? Leukotrienes induce bronchospasms, and prostaglandin inhibitors like aspirin can induce asthma attacks. Even though drug therapy does successfully block enzyme systems, arachidonic acid can still be converted into other damaging molecules. Because of this, another option is to treat the diseases involving eicosanoids with your diet. Not all phospholipids in cell membranes include arachidonic acid, only ones derived from dietary fatty acids, mainly linoleic acid. So if the diet can be controlled by starving the eicosanoid system, eventually arachidonic acid production can be reduced, thereby slowing down the production of eicosanoids when stimulus occurs. There are 2 main fatty acid groups to consider in relation to this dietary approach: omega-6 fatty acids and omega-3 fatty acids. Omega-6 fatty acids, which do become phospholipids, should not be used as they are easily converted into arachidonic acid. Omega-3 fatty acids are the correct choice as they become phospholipids that are not easily converted into arachidonic acid. In conclusion, there are 2 basic means of interrupting the pattern of inflammation that seem evident. First, avoid producing arachidonic acid by ingesting less linoleic acid while making a conscious effort to eat things high in omega-3 fatty acids so that the initial stimulus to inflammation produces less arachidonic acid. Second, inhibit the enzymes COX and LOX that are involved in the production of eicosanoids from arachidonic acid by the use of drug therapies including steroids, other prescription drugs, and over-the-counter non-steroidal anti-inflammatory drugs. Future work. Because it would be in the best interest to inhibit both COX-2 and 5-LOX to maximize anti-inflammatory effects, many drug researchers are now seeking compounds with low toxicity that could block both these enzymes. Gina and I would like to thank you for this learning experience and for taking the time to review our presentation. Thank you.